Good morning, everyone, and today our this lecture is about pediatrics oncology. Now, pediatrics oncology. What is the importance of this topic? Is basically to know about the common cancers in pediatrics. Though you must have the general idea about what are the common cancers and how they present. Um, like at this level, and when talk about like this level is basically in different exams, no one will ask you about the details of cancers or chemotherapeutic drugs, but you must have the general idea how different cancers present and what is the things or what actions we can take against them. So to tell you the importance of this condition, basically cancers is the second most common cause of death um, after injuries in children after 1 year of age. And the causes of these cancers are not well known, but sometimes there are some associations which we know, like Down syndrome. They are uh, at risk, or they have increased risk of developing certain conditions, like one of that thing is leukemias. And there are many cancer predisposition syndromes as well. There are many immunodeficiency syndromes. There are many family histories, exposure to the radiations and chemicals. Or if you had done oncology, of course, like the mainstream oncology I'm talking about. Okay. So if you can see in this one, of course, like this one is showing percentage of all childhood cancers in the UK. Uh, what's the purpose of showing you this thing? Is to tell you what are the most common cancers in the pediatrics. So you can see over here, leukemias are the most common one, followed by the brain tumors. And then there is lymphomas. Okay, so leukemias being the most common, then spinal tumors or brains and spinal tumors, then lymphomas. Though neuroblastoma, soft tissue sarcomas, Wilms tumor, which is uh, the one related to kidney, bone tumors, retinoblastoma are also there. So of course, like I will be talking about a little about this one. In this slide, there is a complete detail of the leukemias, but of course, we are not going to discuss them in details. So the important thing now is what are the issues we face in pediatrics, That's the important point to discuss here. Why? Because, whenever we discuss any, diagnose any carcinomas, uh, of course, like we go for the surgery and then we go for chemotherapy and radiotherapy, and simply uh, after doing chemotherapy and radiotherapy, like these drugs, or these treatment modalities are not without any side effects. Rather, there's a lot of side effects. For example, almost like all the therapeutic drugs, they causes bone marrow suppression, so they present with anemia, thrombocytopenias, neutropenias. So of course, like all of them, they are immunosuppressants, so they have repeated infections, and they alopecia. So all these things, and children, they get like more and more side effects, and it can cause with their growth and development. So that's being the important thing. So of course, like what is the decision in the treatment thing is not your domain. Rather, it's a specialist domain, and like they decide according to the cancers, according to the staging, like what to do. So you can see here, like in this slide, it's written over here, presentation of a malignant disease in children. And you can see, like here, they are dividing the cancers into three different categories, right? Preschool, school aged, and adolescents. So you can see like ALL or acute lymphoblastic leukemia and neuroblastoma, Wilms tumor, as well as retinoblastoma. So basically, the last three are more common or more prevalent in newborns, and like these three, the bottom three. And now the school children or school aged ALL brain tumor, whereas in adolescents, there is malignant bone tumors as well as soft tissue sarcomas as well as germ cell tumors also come into action. So now you can see over here presentation of cancers in the children. Um, by the way, brain tumors, see raised intracranial pressure, neurological signs, and by the way, like in surgery, there is a topic of uh, brain tumors. I'm sure like that one is done already. Uh, so in that one, like we study all the brain tumors in detail. But uh, remember, like brain tumors causes raised intracranial pressure, and they present with the same things like headache, vomiting, behavioral or personality changes, visual disturbances, papilloedema. They have more vomiting and all these things. And these are the type of tumors like supratentorial tumors and midline tumors and infratentorial tumors and spinal cord tumors, right? And again, you can see over here typical case history as written over here, and they have shown you MRI scans. Okay, retinoblastoma now. Okay, as I told you that retinoblastoma, which is a tumor of the eye, uh, like it is most commonly present upon birth, and that's why when the babies are born, we do light reflex. So you can see like normally uh, when we use ophthalmoscope and we check the light reflex, basically we get a red color here. If like there is cameras like which have red eye reduction function. So basically what is that, like when the light falls on the retina is red, so we can see the red reflex. But if there is anything in between the retina and the light, so of course like red color will not be seen. So in this case, like there will be white pupillary reflex, which shows like there is some growth inside the eye, or which in this case, like what we are discussing is basically retinoblastoma. Okay, retinoblastoma. Now, retinoblastoma, most of the time, it occurs in the newborn. Okay, and it's not so common. It's not so common. Okay, it's a rare type of cancer, but simply this can occur. So, simply like whenever it is there, so what they do, uh, they like nowadays there is a lot of other therapies are available as well, but before like they used to do enucleation of the eye. So we can use radiotherapy, laser photocoagulation, and nowadays like chemotherapy is also available. Okay, so uh, in the good health systems, guys, retinoblastoma has very good outcome. By the way, very good cure rate, simply you can say. And like they can successfully treat that, and they go into adulthood. Okay, and lead a good life simply. Now, other than that, you can see over here lymphomas, right? So regarding lymphomas, you can see over here, told you, like, what is the incidence of lymphomas, right? So third most common one. And to tell you, like, about lymphoma, when it comes to the lymphomas, okay, so uh, they present with a large lymph nodes in the head and neck, abdomen, mediastinal mass, may cause superior vena cava obstruction. Uh, there it could be Hodgkin lymphoma as well as non-Hodgkin lymphoma, right? So it could be any one of them. But non-Hodgkin lymphoma is more common, you can say, in the babies who are less than 5 years of age, and more common in adults, or you could say adolescents. So whatever is there, you had done Hodgkin lymphoma and non-Hodgkin lymphoma, and if you want to know more about that, like, there is a video in the hematology internal medicine section talking about this lymphomas in detail. But simply, how these patients present, like, they present with enlarged lymph nodes. So they present with painless, um, sometimes cervical, sometimes clavicular, supraclavicular lymph nodes enlargement. And they have the mediastinal mass as well, which gives like secondary symptoms like dyspnea, cough, and some constitutional symptoms like fever and all this stuff. So, non-Hodgkin, less than 5 years of age, and adolescents, it is Hodgkin type. So, whenever like the lymphomas are diagnosed in the patients, uh, again, it's the combination of chemotherapy as well as the radiotherapy which is used, and therapy is simply to, um, you can say, to eliminate, you can say, the abnormal cells from the body. So chemotherapy have a lot of side effects, as I told you, and that's why, like, there is a lot of limitations, and the children, it's not like it's specialist domain, or you can say, there are people who are pediatric oncologists, they decide what kind of chemotherapeutic drug should be given to these patients. So now, Wilms tumor. Now Wilms tumor is also called as nephroblastoma. Okay. So Wilms tumor, by the way, uh, is also uh, one of the tumors which are present in the abdomen. And as I told you, like, whenever a newborn baby is diagnosed with a mass in tummy, always think about Wilms tumor, right? So uh, this one is usually diagnosed, by the way, is usually diagnosed around 2 to 5 years of age. And what happens is, like, the kidneys are basically enlarged. So see, large abdominal mass in a well child, occasionally anorexia, abdominal pain, and hematuria, right? So this is how they present. Okay. So most of these babies, they are asymptomatic, and they present with hypertension, they present with hematuria, abdominal pain, sometimes vomiting. And one thing about Wilms tumor which I wanted to talk about here is uh, Wilms tumor. It is also called as nephroblastoma. Okay, so basically, sometimes it is also associated with other congenital abnormalities. For example, one of the things is called as WAGR, Weger syndrome. Okay, so what is Weger syndrome? Basically, W is for Wilms tumor. I will write it down here. It is Wilms tumor, okay, with aniridia with genital anomalies with um, retardation, or you can say mental retardation. Okay, so mental retardation, of course. So it could be associated with this thing, or sometimes it could be uh, due to one of the syndrome called as Beckwith um, Weidman syndrome. And now this one, Beckwith Weidman syndrome, uh, very easy to remember. Like this syndrome, like basically there is increased in the size of the body organs. For example, tongue will be increased, and sometimes they present with hemi-hypertrophy. So they have like the big, you can say, regions or organs in the body. So they have adrenal hypertrophy, they have renal Wilms tumor or nephroblastoma. So anyhow, whenever anyone is diagnosed with Wilms tumor, what can be done is, remember guys, like whenever we diagnose any type of carcinoma, not in children, but like rather in any age group, children, adults, who else ever he is, what they do, like the first thing is to make the diagnosis, right? Like either it's what kind of cancer, either it's a squamous cell or whatever, like whatever XYZ types are there in each area. The second thing they go for is staging, and I mentioned this thing many times. It's very easy to do staging, or remember to do like what workup is needed for the staging. Most of the staging are T&M staging, by the way, in which like we check for the tumor size, we check for the nodal involvement, we check for the metastasis. So simply we run CT scans or imagings of the chest, of the abdomen, of the head and neck. We do PET scanning for the bones and CBC and LFTs, things like this, and they see like how much this cancer is spread, right? So depending on the staging, they treat the condition. For example, Wilms tumor most commonly metastasize to the lungs. Now, once they have done the staging, then they go for the treatment. So the treatment remains somehow same. In this case, what they will be doing, they will cause nephrectomy. They will do nephrectomy. They are going to remove that kidney. They are going to provide chemotherapy or radiotherapy. The good thing about Wilms tumor is like simply the survival is very good. Most of the children, they survive like long-term life, okay? So Wilms tumor, the survival is good. Even the retinoblastoma, the cure rate is good. So Langerhans cells histiocytosis, so they present with seborrheic rash, widespread soft tissue infiltration, bone pain, swelling or fracture, diabetes insipidus. It is not so common. Soft tissue sarcomas can occur at any site. Neuroblastoma is one of the interesting things, by the way. So, what is neuroblastoma? One thing about neuroblastoma, guys, it is the most common cancer occurring in the first year of life. Okay, neuroblastoma is the most common type of cancer which occurs in the first year of the life. So, what is neuroblastoma? Simply, neuroblastoma is caused by, or not just caused by the way, you can say like the neuroblastoma is basically the tumor which arises from the neural crest cells. Okay, so now when it arises from the neural crest cells, what happens is like these patients who have neuroblastoma. So they uh, basically present as a mass. So it could be an abdominal mass, it could be a mass in the neck, in the chest, or the most common site is the adrenal glands. So now, of course, like the sign and symptoms depends on the location of this mass. Uh, for example, if this mass in the neck, the sign and symptoms will be different. Sorry, the sign and symptoms will be different, but some will be same as well. Uh, in abdomen, it will be different. Uh, what happened? Like these tumors, basically, they cause a spinal cord compression, weight loss and malaise, pallor, bruising, and bone pain. So the bad thing about this is what this carcinoma or neuroblastoma uh, most often it is diagnosed lately. Like when the patients they present with sign and symptoms and they start doing investigation. So until they will reach the diagnosis, the time is already passed and the disease is quite advanced, you can say. So when they diagnose this condition, neuroblastoma, most of the time these patients are already at advanced stage, like they have metastasis to different parts of the body. And uh, most often, for example, bone pain occurs due to metastasis to the bone. So maybe the patient will present with bone pain, and that's why, which will lead to the diagnosis of that cancer. So bone pain already occurred due to metastasis to the bone. Or for example, someone presenting with abdominal pain, okay, with weight loss, anorexia, hepatomegaly, things like this. So which can be uh, of course like metastasis to different parts of the body already, right? So remember guys, neural crust cells, neuroblastoma, it present with increased formation of catecholamines, and that's why the babies they present with weight loss, they present with malaise, they present with hypertension, they they present with sweating, they present with diarrhea, they present with failure to thrive, all these things neuroblastoma patients present with. So now uh, most of these babies upon diagnosis they are already in advanced stage, and uh, when it is advanced stage, simply uh, it's hard to manage condition, okay, like because the disease is already widely spread. But again, there is some prognostic scale they use to check for the prognosis of these patients, and based on that they decide about the radiation, about the chemotherapy, about the surgery, or about the immunotherapy. So this is about neuroblastoma. Okay, one of the thing which I wanted to talk about now, like see, I talk about lymphoma a little. I will talk about acute lymphoblastic leukemia, malignant bone disease. Of course, like they are more common in adolescents. Why? And like the school age children. So bone tumors, by the way, are more common in children. Uh, so if you have the concept of leukemia, guys, the leukemias will remain same, either it's in the adults or in the babies. But the important thing to remember, like ALL or acute lymphoblastic leukemia, is the most common cause of leukemia, type of leukemia in pediatrics. Uh, okay, one of the thing which I wanted to talk about is most of the cancers they present as lymph node enlargement, or what we call it as lymphadenopathy. And that's the reason the parents bring their children that our child have lymphedema, like basically they don't know it's a lymph node, rather they say our baby have lumps and bumps, okay, or a lump if it's one. So how we approach lymphadenopathy is quite interesting, and what are the things we look for in pediatrics in babies, okay. uh, so like we will discuss that thing in a while, but for example, if I will talk about leukemias, guys, uh, okay, this slide have a lot of details about leukemia. And leukemia is the most common malignant neoplasms, right? As I told you. So, uh, the mean age of diagnosis of leukemia is around 2 to 5 years of age. And ALL being the most common. Uh, wait. ALL is mostly 80% of the time. This is ALL. Okay. And 15% of the time it comes back as AML. Okay. And now one interesting thing to know here, that it makes 95. So if you will see over here, they are talking about like 97% of the cancer leukemias are either ALL or AML. But remember, ALL is the most common one. 80% of the time it is ALL. And CML is rare and CLL is confined to adults. So CLL doesn't affect the children, but CML do affect, but less than 5% of the times it is CML. So the most common is ALL, you must not forget, or whatever, like you can say 97% of the times, it is ALL or AML. And I told you one of the thing, like the Down syndrome thing, guys, remember Down syndrome, or the children with Down syndrome have 15 times more chances of developing leukemia than the other babies. 15 times. Okay. So actually, I'm not talking about the details of leukemias, because I'm sure like you guys are already fed up while studying them in internal medicine. But I have the lectures on leukemias, in my internal medicine playlist. So what happened basically leukemia? What is leukemia? Like, there is leukemic cells. Leukemic cells means what? Leukemic cells are abnormal cells, or like there you can say mature cells, which are producing too fast by the bone marrow, and they are infiltrating the blood, and they are infiltrating the bone marrow as well. So what happens is, now the patients, they present with bone pain and bone marrow failure. So whenever there is, okay, these are the general symptoms over here, right? Malaise and anorexia. But whenever they infiltrate the bone marrow, so see, the bone marrow is the area which is producing all the RBCs, WBCs, and platelets. And what will happen, that when the bone marrow will be infiltrated by leukemic cells, the other cells will not form. And even the cells which the bone marrow is forming at higher rate are abnormal. They cannot do their function. So what is going to happen is, when RBCs cannot be formed, the patient will present with anemia, pallor and lethargy, and all the other features of anemia. When the WBCs will not be formed, in neutropenia or infections, and when platelets will not be formed, so thrombocytopenia or bruising, petechias, and remember the superficial type of bleeds. And now, because the bone marrow is in the bone, so they will present with bone pain. Okay. Now, these leukemic cells will infiltrate the tissues as well. So what will happen when they infiltrate the liver? They will cause hepatomegaly. When they will infiltrate the lymph node, they will cause lymphadenopathy. So, hepatosplenomegaly, when they will infiltrate, okay, the spleen might be working so hard to get rid of their normal cells. So it will become enlarged as well. Rest, it can, guys, engulf any organ like testes, so they will be having testicular enlargement, like central nervous system, so they will present with headache, vomiting, and nerve palsies. So like these are the features of leukemia. And now the abnormal cells which are infiltrating uh, the blood will lead to hyperleukocytosis, like too much cells in the body or in the blood, right? So you can see over here, basically what happens is, uh, we call it as hyperleukocytosis. We call it as, sorry, we call it as hyperleukocytosis. So what happens, like the WBCs are too much in the blood, like now the blood becomes so viscous or thick that it's a medical emergency. Why? Because they are the one which present with respiratory, neurological symptoms due to hyperviscosity of the blood. And what will happen, like the patient can have many complications due to this thing. Okay, so this is called as hyperleukocytosis. One thing is called as tumor lysis syndrome as well. Tumor lysis syndrome, like if anyone have any type of cancers, when you will give drugs to kill that tumor or those cells, so the cells are packets of different things like potassium and all this stuff. So they are going to spill out in the blood, and the patient will be having tumor lysis syndrome. So how we manage these things, we give them fluids, okay, as well as allopurinol. Okay, and as well as if the patient is bleeding, you can give them fresh frozen plasma and all the things, like all the supportive management is there. So anyhow, guys, like regarding the diagnosis of this condition, of course, the diagnosis is done by peripheral blood findings in the bone marrow examination. CT chest can be done and all this one. So then we classify them according to the immunotyping, cytogenetics, and molecular. So see, like these are all the subtypes of AML, not ALL. Okay. So anyhow, how we treat this condition is simply a very good diagram, by the way. Of course, we give them chemotherapeutic drugs. So the first phase of diagnosis is induction. So induction, we can give vincristine, steroids, L-asparagine, intrathecal methotrexate, things like this. So what will happen, like they are going to start killing the cells. And then there is a phase called as consolidation and CNS production phase. We give them methotrexate, vincristine, steroid, and thiopurine. And then there is maintenance 1 phase, like maintain the therapy, like monthly vincristine and pulsed steroids, daily 6-mark eptopurine, weekly oral methotrexate, prophylaxis, co-trimoxazole to prevent from the infections. And then there's delayed intensification stage, using different combination of the drugs, and like the last one is maintaining phase. So simply, like this is the treatment for we give like CHOP therapy or like different type of group of the drugs which are available to control this condition. So this one, guys, okay, one of the thing which I told you, like most of these conditions, they present with lymphadenopathy. Lymphadenopathy. Now, lymphadenopathy, like is an enlargement of the lymph nodes, right? So Remember, whenever anyone presents with like lumps in the body, or the parents will complain, lymphadenopathy. Okay, so for example, like you can see the child have enlarged lymph node, right? First of all, you must know what like where are the lymph nodes in the body. For example, this one, see the lymph node is enlarged. So first of all, you must know where are the lymph nodes in the body. Okay, axillary lymph node, trochlear, supraclavicular, cervical, submandibular. So uh, whenever anyone complains about lumps and bumps, or like their lymph nodes are enlarged, like we go for the examination. Uh, we check like what is the size, what is the site, what is the shape, what is the how the surface looks like, what is the color, what is the consistency. Either there is tenderness, either there is any erythema, either the temperature is raised, either it is fixated to the skin or not. So a firm, non-tender, enlarging, immobile, or fixed, you can say. Okay, uh, immobile, plus with constitutional symptoms uh, like weight loss, fever, all this stuff, points towards malignant cause, okay, or malignant lymphadenopathy. Like simply, guys, see uh, if you will found that a lymph node is red, hot, tender, it is of course like due to infection, right? So uh, you can say warmth, tender with erythema. Okay, like these features are not fixed, of course, not fixed. Okay, because like malignant conditions, they destroy the joining structures. So not fixed, like points towards uh, infectious causes, infection simply, right? So now, parents bring their children and they say like, one of our child, like someone we know, like he was diagnosed with a cancer, like for example, ALL, acute lymphoblastic leukemia. So see, our child have uh, causes of lymphadenopathy. LAD is the short form for lymphadenopathy. So maybe our child have cancer as well. So uh, a very important clinical things, to see either it could be like cancer or not. So it could be the most common cause of lymphadenopathy is infections, guys. Remember this thing. Now infections could be, remember, viral, could be bacterial, could be others. Okay. And other causes of lymphadenopathy are autoimmune causes, as well as malignancies, as well as storage diseases, and again others. So, for example, viral causes infections. There are many viral infections like upper respiratory tract infection, EBV, CMV, HIV. Many bacterial infections now. Others means like spirochete infections, protozoan infections, fungal infections. Autoimmune conditions like rheumatoid arthritis, SLE, and stuff like this, and malignancies. Just now we study about lymphoma, leukemia. Storage diseases you have done in biochemistry like Gaucher's disease and others. For example, there could be Kawasaki disease, which we have to cover, right? Kawasaki disease, or one condition is sarcoidosis. So, like all these are the causes of lymphadenopathy. So remember, guys, the most common cause of lymphadenopathy is infections. Okay, so and most common infections is viral. So the things are clear now. Uh, there is a lot of guidelines, how to see the size, what to do if the size is this much, what to do if the size is this much. But of course, we start think about the common things and we go towards the complicated things. So simply, if you know the causes, you have to know the investigations. Like if I will ask you to investigate anyone who have lymphadenopathy, what test you must be doing. So of course, start with the basics like CBC, ESR, and CRP. So like these will make the things quite clear. Do the blood culture, infection being the most common cause. Do the serologies for rheumatoid factor, anti-neutrophilic antibodies, things like this. Viral serologies. Okay. So I can write over here infections and CTDs. CTDs is like connective tissue diseases. And now go for a chest X-ray. Do test for TB. Do a biopsy. In case of cancers, of course, you are going to do the biopsy, right? So many investigations can be done, and depending now, see, when we take the history or when we do the examination, we see like either the lymph node is involving one part of the body or the lymphadenopathy is generalized, affecting all over the body. Things will become clear. Generalized lymphadenopathy, generalized condition like leukemia, lymphoma, sarcoidosis, things like this, or CTDs, connective tissue diseases. But a localized one will point more towards an infection like bacterial, viral. For example, someone who have the swollen lymph nodes of the neck, of course, think about the infections. Okay. So, okay, guys, that's all about this one. And of course, like if you have any questions, you can ask me. And that's all about oncology. And I will see you in next lecture, right? Thank you.